we come to the floor. What is present in the floor? Look here. We have removed the roof. Again, listen carefully. Here is the triangle. Lower part of sternocleidomastoid posterior border. Right? Here, clavicle. And we cannot see here, but actually from here going like this, oblique muscle is omohyoid. And in between this area is supraclavicular or subclavian triangle. Now, if we remove the skin, then we remove the superficial fascia, including platysma, supraclavicular nerves, and external jugular vein, and then we remove or dissect away the deep cervical fascia. You will be able to look at the content of the triangle. Content of the triangle we'll study a little later. Let's suppose we remove the content of the triangle. You are very cruel. You remove the contents of the triangle, which are very, very important for the arm. Then you will expose the floor, right, on which the content of the triangle were resting. The floor of this is scalenus anterior and scalenus medius. These are two structures. I will tell you two more structures. Let me show you the floor. Here is your first rib, right? Now, I'm going to the floor. This is attachment of this muscle. What is this?
Scalene anterior muscle.
Scalene anterior, right? And there is scalene medius, right? And in between them there is some little bit space. This is scalene medius. This is very simple diagram where I want to show that inferiorly this is first rib, and scalene anterior is also tied to the first rib, and scalene medius is also tied with the first rib. Behind that there is another muscle which is not part of the triangle, that is scalene posterior. But why I'm mentioning, because its name is similar. So there is scalene anterior, scalene medius, and behind that there is scalene posterior, but that goes below the first rib and attaches with second rib. That is not our concern at present lecture. In the floor of this triangle, basically what is this here?
Scalene anterior muscle, scalene medius muscle.
And then here, in between here, there is attachment of, yes, serratus anterior first digitation. Attachment of serratus anterior, right? There are many digitations. First digitation of serratus anterior also. So if someone asks you, what is in the floor of this triangle, right? So this is the triangle. Now this is the floor exposed. A good student will tell you that there is scalenus anterior or part of a scalenus anterior, part of a scalenus medius, part of a rib, first rib, and origin of or a part of first digitation of serratus anterior muscle. But I want to know something more important. A very good student will tell that in the floor there is a very, 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 very special opening between the two scaleni. Yes. This is what is very important. In the floor, this is opening. I've mentioned it many times. I'm still mentioning it again because it's worth remembering. This is interscalene what? Space. And from this space, right, because on the other side, deeper to it, there are vertebrae. From spinal cord, interior rami are coming and brachial plexus components are coming in this space. What is this? Interscalene, and emerging out as trunks. And this trunk is, suppose this is one trunk, then there is another trunk, then there is another trunk. So you see, from interscalene space in the floor, there are three trunks of the brachial plexus, they are jumping into and passing through the subclavian triangle. Very important component. Passing through the subclavian triangle, and here they are lying on first rib, and actually at the first rib something happened to them. Let me tell you. These are three trunks. So we will call it upper trunk, yes, middle trunk, and lower trunk. These three trunks of brachial plexus emerging from the floor of subclavian triangle through the interscalene space or interscalene fissure, right, and becoming the components of subclavian triangle, and eventually coming over first rib. Here they divide into posterior and anterior division. Everyone divided into posterior and anterior divisions, and then these divisions will be behind, just lying over the first rib. So, we look here in this diagram. This is sternocleidomastoid. Here we are not showing the floor. Here we are not showing the floor. Floor is in this diagram where scalenus anterior is there, scalenus scalene medius is there, and I'm not showing the outcoming trunks, and this is the first rib, and this is the first digitation of serratus anterior, which is moving like this towards, right? Now this was the floor, but from this opening in between these two muscles there is knotty opening. Through this opening three cords were coming, and these three cords which were coming, they are becoming the content of the triangle, but as they advance downward and laterally, they find themselves just above the, what is this thing? First rib, and here every, what is this? Trunk divide into anterior and posterior division, right? And of course under it, here was, what was it? Subclavian artery, and that artery is also coming over first rib, right? As soon as this artery crosses this point, outer border of the first rib, this becomes axillary artery. This was third part of subclavian artery, but as soon as it crosses the outer border of the first rib, it becomes axillary artery. This is one point which is very important to remember. Now we can see that brachial plexus component, especially these three trunks are passing through the triangle, and also subclavian artery is passing through the triangle. You can see in this diagram that upper trunk, middle trunk, and lower trunk, and subclavian artery, right? But subclavian vein may or may not be present in the triangle, because subclavian vein is below the artery but separated from the artery by the scalenus anterior, scalene anterior, and if it is at little inferior position, it will not be visible in the artery, but if it is, it varies person to person, and if it is a little bit superior, then its edge or a part of this vein, subclavian vein, may be visible in the subclavian triangle. But subclavian triangle is called subclavian because of subclavian artery, not because of subclavian vein, because vein may or may not be present, because vein is the lowermost component. Sometimes it is so much lower that it is dumped below the triangle, right? Now, this business of hiding, right, this is done on the surface of the first rib, but here is your clavicle. So this is actually, if you see, these divisions are above the first rib but below the clavicle. It means they are between a space which is, or between a gap which is below the clavicle and above the first rib, right? This gap is called costo from this rib, costo-clavicular space. I think, let me show you here. You know, these trunks, these three trunks are coming. Here, these trunks, this is transection, and here I've shown the, what is this? First rib, and what is this? Clavicle. And here, this is the origins of
muscles.
interior scalene muscle and scalenus anterior and scalene medius. And the few things to be noted in this diagram, please focus on this. In this diagram, you see that this space, right, lateral side we have clavicle here, right, here it is a ligament, we call it costoclavicular ligament, but below, very important thing, first rib, and superiorly and interiorly, what is this? Part of clavicle. In between them, this is something like fish mouth, right? Fish mouth. This is clavicle above, right, and first rib below. And here is origin of scalenus anterior, and here it is origin of scalenus medius. The very important point is that the vein, subclavian vein, which I am showing here, it is appearing anterior to the scalenus anterior. Vein is here, right? And this is scalenus anterior. Just behind that, there is artery. What is this artery? Subclavian artery, right? So it means subclavian artery and these trunks are moving downward as through the triangle, and as they are moving downward and laterally, eventually they find themselves above the first rib and below the clavicle in costoclavicular space, where they divide into divisions. Every trunk divided into interior and posterior division at this point. If you focus here, you can see these three are purple color interior divisions from three trunks, and these yellow color are posterior divisions from these three trunks. And if we come to our main diagram, come here. What a beautiful diagram. Now, these were the trunks which jumped from where interscalene space into subclavian triangle, and in the triangle, every trunk divided into what? Interior division and posterior division. Interior division and posterior division. Interior division and posterior division. Now these purple are interior divisions. So in cross section, you see these three purple. These are interior divisions. And these three, this, and this. These are three posterior divisions coming from these three trunks. In this diagram, they are shown in here.